Hello and welcome to Softline. I am Nancy Banigo, and as usual, I don't do this alone. I have my co-host with me, Eddie Young. Hey, I usually roll the drum for her. Eddie Young, hey,
I was just watching you to see if you would do that. So thank you for honoring me, Nancy.
Yes, as
Hello,
always,
everyone.
as
Yeah,
always.
yeah. Thank you, everyone. It's so nice to have you on our show today, Tuesday, second day of April. It's quite early in the month, so happy new month to
And,
you all out there. Remember, on Softline, we come your way with interesting, educative, entertaining topics. We get to learn every day when we are here. And we are always excited to know that you're out there watching us.
I'm glad you
Nancy,
remember to add
almost,
it we.
yeah.
And today is
I almost missed that.
our first day on TSTV. So
Let's ring the bell.
New family.
Yeah,
New
yeah.
family.
We're gonna
So we
have
are glad to have you
exactly,
guys
exactly.
here. All right. So Eddie, there's this the issue of DNA, paternity fraud, and everything. It's like every day it's taking a new dimension. You know, I saw in the news today on social media a man who just discovered that his 4 children are not his. We have of 16 years, a 12 years, a 13 years, I think, and an 8 years old child. He just discovered they are not his. You know, so this is on one side. Then yesterday I also saw the son of what's his name, Sheun Kuti, on social media, where he was saying it doesn't make sense, even if you find out that those you children you've been nurturing for so long are not yours. It doesn't make sense for you to start hating them or to like send them away. That shows that you've not even loved them in the first place. So at least people adopt children, people bring children that are not theirs up. So what's your take on this? Even when you find out that these children are not yours, should you still continue loving them like you've always do? Or, you know, would your behavior, everything just change overnight or discovering the truth?
Honestly, you shouldn't stop loving them. But you see, there is something about emotions. You know, that sudden realization that, look, I'm not actually the real father could break the person. So that person actually needs some form of therapy to come to reality. You know, if you're adopting a child, you know you're adopting, so you've prepared your mind mentally, emotionally to know that, oh, this child is not mine, but I want to adopt this child. So it's a different scenario, you know, to a one where you felt you actually fathered the child and then you realized it's not yours. So emotionally, I think what happens is a situation where you can't really control, but over time, the person, the father, should be able to adjust, because really, we're meant to love everyone, whether you father the child or not. So I support Sheun Kuti's opinion. You're not supposed to hurt the child, but I can also understand at that initial instance, initial reaction, but I only encourage get over and love the child. Yes.
Yes, I know initially it's always like a trauma about you with time.
Yeah.
Anyway, it's easier said than done, seriously speaking, because I can imagine what those people go through, discovering after how many years. First of all, there's this sense of betrayal, like you've been betrayed, you know, you've been lied to, you know. So that alone, it takes you to another state of your mental.
That's why I say it's the emotional thing. And you know, I also realized, I got to read about it, that some twins have different fathers. That some twins, if the mother, the wife, you know, got impregnated by the husband for one egg, the second egg could have been fertilized by another man. And so in such cases, you can have twins coming.
Yeah, even at that, there was still a betrayal.
Yeah.
There was still a betrayal.
We can't rule out the betrayal part. But then what happened? What made these people betray them? You know, those are things we actually need to understand.
All right, let me now ask you, if it becomes like a normal thing after giving birth to a child to, you know, conduct a DNA, or for every man to wake up today and say he wants, like your husband now coming out to say, okay, my children, I don't care, let's just conduct a DNA test. Would you feel a sense of like he not having trust in you? Would you accept it?
I'm human. I would like that to be ascertained, but I may have this emotional trauma that he doesn't trust me. Okay. You know, definitely I'm human. Okay. So that, especially when I know I haven't done anything, you know.
Okay.
So it's normal. I can only be afraid if I know that
You've done.
yeah.
But sometimes you
that
might
I'm
not
on.
even remember.
Remember what, Nancy?
Sometimes you might not remember.
Remember what?
There's this research. There's this data, whatever. I don't know how they came about that. Their research analysis and results that 90% of the first child of every home doesn't really belong to the father of that
The
house.
first child, right?
Yes, the first child. And you know how first child thing is. Probably your wedding day is tomorrow. Today you're with your ex and say, okay, let's just hang out for the last time before I
But
finally
it doesn't
get.
apply to everybody.
No, I know it doesn't apply to everybody. I'm just saying, with that research and all that. So with this, it's putting so much doubts in the minds of so many men. No matter how much they trust their wife, they are beginning to have doubts. And the way these things are so common or popular on the social media, the moment you open the social media, you are seeing this news. Every human being will begin to have that doubt. So many men, even no matter the trust level they have for their wife, when they get back home, they tend to look at their children and say, in their mind, they're like, is this child really?
Especially when there is no
physical,
feature,
exactly.
So you're like,
exactly.
No, but for me, with the trend, I feel it's time you start to do your DNA early enough because it's traumatic for you to put a child who has been with you, whom you fathered, for up to 16 years, and then these issues come up, It's not about you now. Every other person, even the children, are involved. So with this trend, I feel let's start early. Carry out a DNA, no matter how expensive it is, and then be sure that you're actually raising a child who is actually yours.
Okay, so Eddie is advocating for a DNA after birth, right?
Immediately
after birth.
Or
okay.
in fact, even while pregnant.
Oh, okay. All right. So the earlier, the
The
better.
earlier, the better.
All right. So we'll go on a very short break, and then when we'll come back, we'll be introducing our guests as well as our topic. Stay with us. We'll be right back. All right, so today we'll be discussing Lassa fever. The Nigerian Center for Disease Control and Prevention, NCDC, has reported a grim tally of 20 deaths across 16 states in the span of a single week from February 26 to March 3rd, 2024. According to the NCDC's official website, the agency noted an increase in confirmed cases from 96 in the previous week to the current count. So far, Nigeria has recorded 682 confirmed cases and 128 deaths from Lassa fever from week 1 to 9 of 2024, reflecting a case fatality rate of 18.8%, higher than the corresponding period in 2023, which stood at 16.1%. The affected states include Ondo, Bauchi, Edo, Benin, Ebonyi, Kogi, Kaduna, Taraba, Enugu, Delta, Jigawa, Adamawa, Anambra, Rivers, Ogun, and Oyo State. Of particular concern is the concentration of confirmed cases in Ondo, Edo, and Bauchi State, which accounted for 62% of all cases. Joining us to discuss this epidemic is Dr. Edward, consultant, community physician, and public health expert, and also Chairman, Association of Public Health Physicians of Nigeria, Akwa Ibom State Branch. Doctor, you're welcome to the show.
Thank you for having me. It's great to be here.
Great to be here. You know, Doctor, I know we've spoken about Lassa fever some time ago, and I was really hoping and looking forward to the next time we meet. It will be probably some good news on Lassa fever is no longer an issue in Nigeria. But unfortunately, with this tally we're having now, it's as if we are having more cases of Lassa fever. So what exactly is going on, Doctor?
Well, I think, thank you again for having me.
All right.
I think it will be better looked at as a good thing, you know, in the sense that it is reflecting the fact that we are actually having better surveillance.
Okay.
We are actually having better case detection, you know, seeing these cases and then having these cases reported, because unlike in time past where you had cases of Lassa fever and then, you know, poor reportage was there.
Okay.
You know, people were probably just dying and then you don't really know
No
the
records.
cause. Yes, no records. So with what is happening, it's a good thing because with the numbers you are seeing, you can now devise or design policies and plans and interventions that will reach out to, you know, particularly endemic communities like that, you know, that will actually have good, you know, results, you know. So I think I would look at it positively, you know, yes, in a positive sense, that this is actually the way to go, you know, and hoping that with the data that we are actually having from reports from the NCDC, it can now be used to bring out good interventions that will actually help the communities involved.
Okay.
Yeah.
Okay, so talking about Lassa fever, let's also remind ourselves what is Lassa fever,
Yeah, exactly.
what causes
Yeah.
it, and all of that.
Okay, so Lassa fever, like we've talked about some time. Okay, Lassa fever is it's an acute viral hemorrhagic disease caused a zoonotic disease. Also, it's transmitted from vertebrate animals naturally to humans. Vertebrate animals now being rodents, you know. It's an acute disease. That means it takes a gradual short course. It's hemorrhagic because it affects small blood vessels that later on gets ruptured and then blood is, you know, gets into, you know, soft tissues like that. And then it's a fever, it's a viral disease also. So at the end of the day, it's caused by a Lassa virus, virus, you know, that tends to have an incubation period about 2 to 21 days, you know, and then causes, you know, a spectrum of diseases that takes a particular course. You know, so the problem with Lassa fever is that unlike other diseases, you could think the initial affectation of disease tends to look at resemble malaria. So some people think that, oh, I have malaria. So the likelihood is that they're going to start thinking of malaria first. But it progresses in for about 15 to 20% of cases to advanced diseases. The good thing is that 80% of it resolves, you know, spontaneously on its own. But the people that progress to the next 20% tend to present with, you know, conditions like abdominal pain, headache, arthralgia, you know, and all sorts of conditions like that. And then if nothing is still being done, it progresses to, you know, neck swelling, facial swellings, bleedings, you understand?
Bleeding now from the mouth?
Bleeding from the mouth, from, you know, from the nostrils, from various parts, internal bleedings like that. And then, you know, the person start having encephalitis, confusion, and if nothing is done, the person has progressed to coma and death. Okay, so that's usually like the trend, the pattern in which it goes, especially when intervention is delayed and case finding is not done on time. Okay, so in terms of the frequency, you've actually captured it in some of your, you know, early remarks. Yeah. So, but you want to know that annually in West Africa. Lassa fever is actually endemic many times in West Africa. And in West Africa, you can actually get as much as 300 to 500 cases, all right, with 5,000 deaths. But annually, globally, we're looking at 2 million cases, infections, with 10,000 deaths recorded, okay? So it tends to affect men and women almost equally, almost equally, yeah. And then the distribution tends to be all year round, with peak periods occurring between November to March, and some people even extend it to April. Okay, so that's when you tend to have peaks. So what you are seeing now is actually expected, you know, in the eyes of an epidemiologist, you know, that is, you know, actually aware of what is happening, because that period of time is a dry season, and in the dry season, certain kind of practices occur that encourage that, you know, result in the vector, the animal, the rat involved, the multi-mammate rat that causes the disease, or that there's a carrier of the disease, you know, being much more prevalent within the environment where humans reside, and then interacting with humans. Because this rodent, when this rodent feeds, bites humans, you know, in the process of trying to also feed, introduces its excreta, urine, or its feeding its mouth into what humans are going to eat. It introduces the viruses. Understand? Then humans probably eats the meals that have been infected, and are indirect, you know, tend to come down with the disease. So within, like I said, within the period November, it's a dry season, so bush burning activities.
It brings them out
from
the bush.
Exactly. So it brings them out from the bush. They come there, and then when they come out from the bush like that, you have practices like poor waste, disposal practices that occur in our environment. So these animals quickly see the opportunities that are in front of them after bush burning, and they come into the homes, you know, and they begin to feed. And then, you know, of course, in many homes, people are not very conscious about, you know, sealing crevices for rats and all the rest. So the animals see a ready environment where they can come and thrive. And interestingly, these animals give birth to many children. So before you know it, the rat there is multiplying. Yes. And that's one of the reasons why you're having that number and that death. And in certain cases, in certain communities, when the rats come out like that, guess what? Opportunities for protein. So some people
tend to feed on them.
Tend to feed on them, you know, take them up, feed on them. So when an individual comes in contact with an infected one and then feeds on it, there is a risk of the other person contracting the disease.
Even when it is being processed either by roasting it or cooking. I thought if they go through that process, it should kill the virus.
Okay, so the issue is this. The issue is this. In the process of trying to kill the rodent, okay, so you have, if the person trying to do that has a broken mucous membrane or broken skin, or, you know, any part, you know, you now come in contact sometimes with the blood or the excreta of the animal. You understand? And that puts you or your family at risk. In fact, in certain cases, sometimes the hunters bring the animals, and the children of the hunters now begin to play with the animals before the animal is killed. You know, so you start seeing, we have found the rat, we have found our bushmeat, we have, you know, so that exposes those people to be at risk of that disease. So yes, at the end of the day, we have communities that feed on it, but what happens at that interval between how you want to roast the meat and then when you catch the meat? And in fact, even with the roasting, some people do not even roast properly. Yes, some people do not roast properly. They roast it partially like that, and, you know, they're in a rush to, you know, eat what. So at the end of the day, you have, you know, these people coming down with this disease like this. Yeah.
You know, is it every rat that we come across that is infected? I'm asking this question because I remember I saw a video of a woman who just opened a bag of rice. She said she just bought the rice, and the rice was, you know, still plenty inside the bag. And you know, this economy now, she just opened and saw a dead rat inside. So she was now asking on social media if she should throw away the rice or could she still eat the rice.
Okay, so the multi-mammate rat is a unique kind of rat. It's larger than your normal rat. It's larger than a normal rat. It has, you will see that it doesn't have hairs on the tail.
Okay.
Yes. So one of the interesting features is that it doesn't have hairs on its tail like that. And then when you turn it upside down, you see all the mammaries, especially for females, being displayed with dark white patches there as well.
Okay.
So it's a big rat. You know, it gives birth a lot, and then you see the hairless tail. The hairless tail gives it out, you know, as the multi-mammate rat. Now, for when you see for meals like rice, where you know at the end of the day, it's unlikely for humans to eat rice dry directly.
Okay.
Like that. You're likely going to wash the rice, you're likely going to cook the rice again in high temperature before you eat. That is, you know, it's unlikely for the person to be, you know, the risk is reduced. Let me put it that way. The risk is reduced. But what happens if it was Gary?
Exactly.
You know? What happens with this Gary? Because one of the practices we like doing when we get to the market is when we want to buy a Gary, you just put your hand into the Gary and put it in your mouth. So you do not know what has happened ab initio before that period. You know, you do not know what has happened. And you know, the way we process our meals in this past is very interesting. You know, when you go up north and you're traveling, you see how they process the meal along the road. You know, they put the meal along the road. They put, you know, it's cultural. It's what we have been doing from generation to generation. You know, so what happens? Nobody's there to watch. Nobody sits down there to watch. What happens when the rat or this rat goes there, feeds on it, urinates on it, you know, and then you end up coming to take it like that and bring it home. So those are some of the practices that encourage this disease to spread within our environment. Yeah.
All right. So talking about spreading, doctor, I really want to know why is it predominant in some states? What's so particular about these few states I just mentioned that makes it more prone to Lassa fever?
So some studies have shown some particular practices to be more prevalent in some states compared with other states. Okay, so like I served in Taraba State, and I saw, you know, this practice of displaying food on the highway as something that they do very, very commonly. You know, so probably that is one of the risk factors that they experience, you know, or that they have. Okay, then when you come to Ondo State and then Edo State and others, in fact, if you look at how the states are distributed, they're just almost within a particular area, within a region. Yes, Edo State and Ondo State, they are known, and Benue State, Benue State particularly. You know, we talk about eating rats. Prevalent amongst those states. So could it be that maybe that is one of the reasons? I'm not pointing fingers there. I'm not pointing, you know, so that somebody out there doesn't quote me. But could it be that it's one of those practices that, you know, is causing it? And then, like I said, it's a good thing because it speaks to the health system there. Because the health system is sensitive enough to the surveillance system, you know, to pick up these cases of Lassa fever when they occur. Like Edo State has IRA Specialist Hospital there, and you know, well-trained public health physicians and epidemiologists. So the likelihood is that they have probably gone out there and done good surveillance, and they are picking up the cases much more than how some other states are doing. I don't know if you remember the Trump episode during COVID virus. Trump was like, the reason we are seeing much COVID cases, because we are doing more testing and more testing and more testing. So these people, they're out there, they are doing a lot of good surveillance. You understand?
Okay.
They are picking up the cases, and I think that they should be applauded. They should know that they are actually doing a good
They're
job.
doing well.
Yes, picking up the cases here. In Akwa Ibom here, we are not found as much. In fact, from the records I've seen, I think we have only found only one case
Okay.
of Lassa fever. So is it possible that we do not have that number of cases of Lassa fever in Akwa Ibom?
Or there's not much surveillance, no much
Yes,
advocacy. People are not speaking
or
out.
yes, yet again, could it be speaking to the strength of our health system? Could it be saying that we are not doing as much as we should to detect these diseases within our milieu? Because if we are, many other states, they are picking it up. So why are we having, I'm not,
And we are surrounded by some of
and
these
we are
states.
surrounded a lot by these states. We are surrounded a lot by these states. And of course, you won't tell me that you don't eat bushmeat here. They don't tell me that they don't.
So does that also inform us that there could be more ways of contacting it beyond what has been established?
Yes. Well.
Beyond the rats.
Yeah, beyond the rat. Yeah. So I've looked at studies. A lot of studies. Look at the possibility that whilst we have identified Mastomyces nataliensis, that's the animal, the vector that is implicated in the transmission of the disease, it is possible that you also have other rodents, other animals, or other means, for which this disease is transmitted. Now, I'm not saying also, because you also have the disease tends to be easily transmittable amongst healthcare workers. Yes, healthcare workers, because a lot of healthcare workers, people come down, oh, I have malaria, and then, Lassa fever is not one of the earliest things you want to think of first. You understand?
Especially when the symptoms are similar.
Yes,
Exactly.
So person comes in, and then it's only after you have given treatment and there's no resolution, and then you begin to say, oh, this person has a history of maybe travel or has a history of consumption of rats. Then you begin to know that, oh, the chances are that this could be
okay.
Lassa fever. So that informs us that informs the reason why case fatality, amongst healthcare, because healthcare workers tend to come down earlier, much more than in the normal community. In fact, the case fatality is as high as 15% and above within the hospital facility. Yes, within the hospital facility, and about 1 to 2% in the general community.
Okay.
You understand? Because health workers tend to come in contact with these patients very early.
Okay.
And in the process of doing that, you could actually contract the disease, and then,
now, when you're talking about contracting this disease, someone might be confused there. Is it just blood by, coming in contact with saliva?
Yeah, the aerosols, nasal,
of the affected person.
Yes, of the affected person, coming in contact with the body fluid of the person, the blood, saliva, semen of the individual. Yes, these are the modalities in which, when you come in contact in the course of care of the person, even if the person even stays in the house, or that's why you want to quarantine. Okay. You want to quarantine families that have been at risk of exposure to these persons, to see, because in the course of the person talking, close contact, in the course of the person sneezing, coughing, one of the symptoms the person tends to present in the second stage is productive coughing. So the person coughs and sneezes, or you come in contact one way or the other with body fluid, and you don't know which family member has a broken skin. You understand? Has a broken skin, or which healthcare worker already has. So that's why one of the things we advocate for health workers is to consistently maintain universal precaution for patients that come in. Okay. So you don't want to assume anything. You want to make sure this patient assume that is carrying the worst case scenario, and maintain universal precaution in the course of caring for the patient.
All right. Now let's talk about advocacy. Before we have to go on a very short break. But when we return, I would like us to talk about advocacy.
Okay.
Some of these states that don't have any number of
The reported cases.
Yeah. Are they relaxed? How easy is it for them to also have these cases in the states? What are those things that agencies are doing, like to educate people on the problem so as to prevent it? But we'll go on a very short break, and when we come back, we'll continue with the discussion. Stay with us. We'll be right back. All right, thank you for staying there. Remember, you can join us on YouTube, ADBN TV, live on YouTube, and you can also drop your message for us. We will read it from there. And if you also want to watch a repeat broadcast of this particular episode, you can also go to YouTube, where we have our softline under ADBN TV. All right, thank you so much so far, Dr. Edward. Yeah. So I was talking about the states that are not, that don't
haven't come down with the Lassa
exactly
fever.
So what are efforts that are being made to make sure those states do not have those this problem? I'm talking about advocacy level.
Okay. So the Nigerian Center for Disease Control and the NCDC has they've made efforts. They're making strong efforts to for surveillance, to increase surveillance among, various states. There's they have this SOMAS, the Surveillance Outbreak Response Management Analysis System in place that tries to, make sure there's prompt reporting of cases, especially when these cases are seen. So it's the prerogative of healthcare workers, healthcare providers, when you see these cases, to make sure you report, and also on the part of the individuals in the communities, because sometimes we have we actually have sometimes poor-seeking healthcare habits. Yes, poor-seeking healthcare behaviors that makes us not to go to the hospitals first. Many of us when we are ill, we tend to say, let me go to the over the counter. Let me take the drug over the counter drugs first, go to the chemist before I go to the hospital. So in doing that, you are delaying probably inevitably, because sometimes you could actually be dealing with Lassa, in certain cases. So it's good to encourage people that once you begin to see some symptoms like that, it's advisable for you to go to the hospital very, very fast, because I think that's one of the things that we tend to battle with, in many of these states that probably are not giving good numbers, access to healthcare facilities, not just access to healthcare providers, but the healthcare facilities that are there that are able to manage, and report. And then it also speaks to, like I said, the reporting. Healthcare workers should be trained much more to report these cases, yes, when they see it, and not just think that, I've seen this one, and then they just keep managing. It's not just about just managing. It's important that cases when they are seen, they are also
being
reported
reported.
as well. Yeah.
Okay. You know, when we talk of most of the symptoms, things like it's almost the same with COVID.
Yeah.
They have the same symptoms,
yeah.
so people can be confused.
Exactly.
And would want to take over the counter tablets, you know,
Yeah.
for those initial stages and all that. Now, let's talk a little bit about vaccine. I think since it's a peculiar case with West Africa, isn't it high time we have a vaccine to like tackle this epidemic, the Lassa fever?
Okay.
Or do we have anyone on ground?
Well, to the best of my knowledge, for now we do not have a vaccine for Lassa fever. But however, I know that 30 candidate vaccines have been, are currently, on trial. I think 4 of them have actually entered preclinical trial stage, you understand, for use as, vaccines that are going to be used for Lassa. But for now, we have not gotten to that point. We have not gotten to that state where, we can say we can use a vaccine like, what we've had in malaria and what we've had in COVID for Lassa fever. But I think progress is being made, over the years. In the coming years, I think that there's going to be progress made towards having a vaccine that will actually, one thing you must realize that Lassa fever is an NTD. It's a neglected tropical disease. Yes. So, and because it is neglected, it's within that West African sub-region area, so it's not getting the attention of the West, of the globe, yes, as
so
much
it's
as
our
it should.
problem.
Yes, so it's more like our problem per se now. So, but I think that it's still, I know WHO is still doing a lot, like I said, to get these candidates out there after, fulfilling all the stages where they ought to be. But I think over time, we're going to have a vaccine for that.
And, okay, you want
So
to say?
having stated this obvious, what have the health workers done concerning handling this issue? Do they wait till the patients come presenting the case, or they go out there? For example, the case you stated in Akwa Ibom where just one case has been cited. What efforts have been done, maybe like contact tracing or history, trying to take history to know how it presented, and then to know maybe there could be other people around. Do health workers wait until these people come to them, or
They
they've
go to
been
the
going to the
hinterland?
field, to see how they can handle that?
So it's how would I put it here? Surveillance could be active and it could be passive. Okay. So in active surveillance, you're actually going out there, but it's difficult for you to say you are going out there deliberately trying to get someone that has COVID, or someone that has Lassa fever, or someone that has, so it's you sometimes want to, wait and get, that report that, okay, this particular suspected case has come, and as the suspected case is not responding to certain drugs, is not going through, it's having this particular set of symptoms. So with that now informs, case finding. You now want to go out there and now investigate contact tracing. You now want to see all the people that have been associated with that particular person. You understand? And then begin to probably quarantine. In the case of the person that is infected, isolate. And then within that incubation period of time, incubation period, you want to know if anybody still comes down with COVID. So it's very expensive for you to say you want to go from house to house, looking for Lassa fever cases. You understand? Because that will be. But usually, like I said, once a case comes like that, a lot goes into trying to make sure that the case finding is actually watertight, and then people like that are not infected out there, So that's what I think that happens within the state. But I think going forward, most people are looking at other means, other methodologies. Healthcare workers, like I said, they play a key role. In the hospital. Once you see a high index of suspicion of a case of Lassa fever, you have to report it. You have to make sure it gets to the authorities, and then almost immediately you set up the ball for contact tracing to be done. You understand? So that all the people that are the relatives, how long has the person been, travel history, you know, who you have been with, the wife of the person, you know, all those things are done to make sure we don't have an outbreak in our communities.
Okay. So what are those preventive measures? Like we're talking about people now ordinarily, apart from the keeping the rats away. I know they always say keep your environment clean and all that. So what are other preventive measures that people can, you know, carry out to prevent this?
So in the case of preventive measures, I will look at it in the light of first of all policy, because I think already we have a lot of policy, but our policy on environmental sanitation needs to really be strengthened, and not just strengthened, but also made much more effective. I like what the Ministry of Environment is doing and the waste management in Akwa Ibom, but I think we still need to do much more because, like I said, one of the drivers of this disease in our milieu is poor waste management. Okay, so is there a way we can actually have individuals dispose their refuse in such a way that, you know, it will not become a problem to the other person and to yourself? Because this thing is a two-way thing. There's how somebody disposes his refuse in a terrible way and draws the attention of the rat, you know, and the rat, and the rat comes to your own house as well. So there should be a clear-cut policy that, you know, people that's enforceable, that reduces improves the way people dispose waste within our community. And then also it's important that people are informed about this. You know, people are regularly informed, like you're doing right now. They are regularly informed about it. They are told about the symptoms. They are told about how it presents, and then they are, you know, they are encouraged to go to the healthcare providers, you know, out there. And not just that, the healthcare providers are also ready, you know, to receive them, because this is not something that is going to be managed in a primary healthcare facility. Yes, this is something that is going to be managed in at least a secondary health facility or a tertiary one that we have. So those facilities need to be stocked up, need to be ready to handle the cases when they come. You know, so things like, you know, universal health precautions in the hospital should be put in place. Healthcare workers, sterilization of equipment, you know, in hospital facilities, you know, in infection control processes in our hospitals need to be kept put in place so that when persons that are infected come in, you know, they can actually, we don't say go to the healthcare facility and then when you go there, it's almost, you know, nothing. Yes, you know, you start struggling. Say, if I know that, I probably would have stayed in my house, you know, that kind of thing. So, and apart from that, you want to also, education plays an important role in this, because you want to bring it out, like I said now, that the way you store your food, the way you keep your food, you know. Okay, let me start from in your house now. The way you keep food within your house is very important. So you want to make sure rats do not have access into your house. So all the nooks and crevices where you have where rats can come into your house are well sealed. And where you have, you know, like you rightly said, that woman that complained of a dead rat in her rice, you know. So all those kind of things could be very discouraging. So you want to make sure all those conditions for rats, you know, are taken off. You may want to explore the opportunities of using either biological means of killing the rats, you know, or rat traps, you know, to get those rats out of your house, you understand, so that you don't encourage them to breed. Because once they begin to breed, they could be a nuisance, and it could be very terrible for you, very difficult for you to manage them within the house. Then outside the house, you know, like we talked about waste management, you also want to reduce conditions that could drive the rat into your house. Now, some of those conditions may not be conditions that you could control. For instance, like urbanization now. Now you're having a lot of people coming from rural areas into the urban areas now, You will not be able to control it. And when they do that, they come and buy lands. And in buying lands, they'll set habitat, natural habitat of these animals, and then animals are driven to, into into homes and all the rest like that. So, but conditions like burning, open burning,
Okay.
burning of houses, burning of bushes
Bushes
and all the rest, also encourage these animals to come in. So you want to look for alternatives. Are there methods that can be used to reduce bush burning or even to stop bush burning? Because these bush burning activities are one of the drivers of these
Because
animals
you're
into
taking them
into
out from
the-
their
their
habitat.
natural habitats,
habitat.
yes,
And
into
bringing
premises,
them,
yes,
okay.
yes. And then also we want to look at like some normal cultural practices also,
Okay.
keeping your food, processing your food on the roadside. Is it possible that government could come in, to support one way or the other, or local government, or people can begin to think more creatively of how to preserve their food rather than putting it by the roadside.
Okay.
Because on the roadside, when you are not there, you have no control. Animals, anything can come in, urinate, eat there, and then somebody comes down with a disease like Lassa. Then like we said again, consuming the meat again could put the family at risk of the disease. So, could it be there's some, these practices have been there for a long time. So people say, my fathers have been eating bush meat or rat meat from generation to generation. But were there data? Was there strong surveillance system, to know why your father died? That kind of thing, or why your mother would have died. That could just be the reason why they probably would have died. So now that you are already knowing, is it possible for you to, maybe if you cannot stop eating the rat meat, you process it better, cook it better, reduce contact, hand contact with that, with the rat, before consumption.
Okay.
So those are some of the, what would I call it? Practices or preventive modalities.
methods,
Yes.
yeah.
So because we don't want to see people come to the hospital, en masse with Lassa,
Lassa fever and all that.
it's
now that we don't have most of the health centers, especially those ones in the Netherlands,
Yes.
are not well equipped to
Yes.
manage some of these cases. But let me ask again,
Yeah.
if somebody, we have just very few minutes to go, if somebody is down with those symptoms you mentioned, the fever,
Yeah.
the cough and all that.
Yes, please.
I remember during COVID, people come down with symptoms, mild symptoms like this,
Yeah.
and they go on to take teas and lemon and
Yeah.
all that. Is it applicable here? I know you're a doctor, you always say go to the hospital when you have these cases.
Yeah.
But aren't there some, method we
First
could...
aid treatments,
Exactly, something like that.
or supplements one could take to shield.
Well, to the best of my knowledge,
I know doctors will never tell you.
to the best of my knowledge, I've not these things for viral hemorrhagic diseases. They could take a. For instance, one of the complications of Lassa fever, if it is not well taken care of, is deafness.
Oh.
Okay.
Yes, the patient can come down with deafness, and it is irreversible. I think it's irreversible. Yes, irreversible deafness. So you don't want to delay intervention. You don't want to delay any kind of it and use methods that at the end of the day, it became too late. Yes, you begin to start regretting. For COVID, you may probably, COVID, maybe that probably could have served in COVID. But for this particular one, it's the best thing is for you to seek immediate health intervention before it progresses. Because by the time it begins to progress and the patient starts bleeding into the brain and the patient starts experiencing coma, it just becomes, almost, I don't want to start using discouraging terms.
Yeah.
So the best thing is that just get medical attention whilst you may, to avoid stories.
All right, Eddie.
So if you're running temperature, don't assume it's malaria.
Yeah. Go for a test.
Yeah, it's
Go for a
better to
malaria
go for a test to
Go for a malaria test
ascertain what it is.
Yeah, to be sure.
I don't know how we will be able to make people to understand that when you're down with the high temperature and all that, the chemist is always the first call.
Yeah.
It's going to be a very difficult task to like stop this trend, stop this. It's like a tradition. So why do you think people tend to go to the pharmacy, to the chemist shop to get these drugs instead of going to the hospital? Because most of these hospitals are not even there. Even when they are there, they do not have health workers to even tend to the population of people coming in there. So lots of people will say, instead of wasting my time going to look for, let me go to the pharmacy and get an over-the-counter drug.
Well,
So I think people should hamper more on the advocacy of using over-the-counter drug. Yeah, because
I see your point. I see your point, but I think over time, as we progress as a developing country, you know, I think we'll get to that point. There's a lot of challenge in the healthcare system that pushes people to seek, you know, easier access to drugs, you know, outside the healthcare system. It could sometimes, it could even be the attitude of the healthcare provider. You know,
Exactly.
It could be the attitude.
yeah,
it could
we
be
didn't
the
even
distance.
talk about that
Yes,
attitude.
So it could be the attitude, it could be distance, it could be access, no road, so many things, you know. So those things, but I think that as we develop, you know, and then we are able to come to a point where people can actually access healthcare without having to think of how much they're going to
The
pay.
cost, yeah.
Yes,
Because that
for the
also
healthcare.
scares
That's
people.
also scares
Yes,
people.
exactly.
The
The
out-of-pocket
financial-
payment for
Exactly.
Exactly.
So
Financial implications.
exactly. So that is it's people the thoughts on the minds of a lot of people when they are coming to the hospital is how much am I going to pay? What we call catastrophic spending. You know, you just come to the hospital and the fear of the bill you are going to be given is enough for you to stay back in the house. You know, so because of that, that's what but I think that as we keep progressing,
Okay.
as the National Health Insurance Act takes hold on society and people are able to begin to get what do you call it? Health insurance.
Okay.
Yes. I think some of those things will reduce.
All right, Dr. Edward, we have to go. But before we go, can you just, talk to our viewers out there in a
Yeah.
nutshell
Yeah.
how, Lassa fever prevention, just little things that they can do.
Yeah. So we've said a lot about Lassa fever. It's important you know about this thing. So one of the most important things you do is hand hygiene. Please, I didn't mention that earlier.
Hand
but
hygiene.
Hand hygiene. Please
Very important.
wash your hands. Wash your hands. Wash your fruits before you eat them. Don't assume. Wash your hands. Wash your fruit. Prepare your meals properly. You understand? Before you begin to consume them, and as much as possible, limit contact with rats, in your house, as much as possible, get them off your house, do the right thing, reduce those practices of when you get to the market, you're putting
Gary
food
in your
into your
mouth.
mouth, without
To taste
processing
it.
it. Yes, and even drinking the Gary itself, you want to be very careful, the way you practice some of these things because they have a way of, impacting on your health. We are believing that with stronger healthcare systems, the deaths from Lassa fever will reduce. But each and every one of us have our roles to play to make sure those numbers come down. And it starts with each of us. Yeah, it starts with each of us. Yeah.
All right. Thank you
you.
so much, Dr. Edward. Thank you so much for your insight and all the education and information we've gotten at this particular episode of Lassa fever. I'm sure you've learned one or two things. Eddie, you have one or two things to say?
Well, I want to thank Dr. Edward for his time on the show and for educating us. And like I always tell us, there is always so much to learn on Softline. So do always stay with us. We'll come your way tomorrow again for another interesting episode.
Yeah. So if you're one of them that, just like Dr. Edward had said, you go to the market to buy Gary, you want to test which one is sour. You say this one is sour, let me test it. And you just pack the Gary. You need to ask yourself that question. Where is this Gary coming out from? Yeah. Where has this Gary been?
Where has it been stored?
Where has it
for
been
how
stored?
long? Yeah.
So you just have to think about all these things before you make that attempt to put it in your mouth. So as much as possible, try to stay healthy. Try to practice some of these things that will keep rats and other rodents away from our environment and our houses. Thank you so much for being a part of the show today. This is the much we can take. From all of us in the studio is bye-bye and thanks for watching.